Well, new research shows that couples who are both obese could have more difficulty conceiving than non-obese couples. And joining us more to talk about these study results is Dr. Shahryar, reproductive endocrinologist at St. David's South. Thank you so much, Dr. Kavusi, for coming in. Such important research. So talk a little bit more about this and how being obese has an effect on having a child.
So this study was conducted at the National Institutes of Child Health and Human Development in Bethesda, Maryland. And it looked at couples where they were trying naturally and up to a year looking at these couples prospectively. And the idea was to look and see if obesity in the male or female or in both partners in that couple had an effect on the time to pregnancy or the probability of being pregnant in a given month, which was defined as time to pregnancy.
And the results show that yes, it does when both the father and mother are obese.
That's correct. That's right. So that was actually the biggest predictor of a longer time to pregnancy, a less likelihood of being pregnant in a given month. And that basically was a finding in the study where if the male was obese in a class where their body mass index or BMI was over 35 and the female had a body mass index over 35 as well, that combination actually had very profound effect on time to pregnancy, and it halved, so it made it in half the probability of pregnancy in a given month as compared to people with normal BMI or couples with a normal BMI.
Do we understand the reason why?
Well, there are a lot of different pathways in the body that could account for it. And we know that just obesity is an independent factor, independent of whether the woman ovulates every month or not. Because of the obesity. So the body in a way may not be ready. There could be a different androgen estrogen profile in the body, and just the idea of having more weight, sometimes the body's just not able to carry that pregnancy. There are lower pregnancy rates, there can be higher miscarriage rates, higher preterm delivery rates, higher diabetes of pregnancy, high blood pressure of pregnancy, a lot of complications that could happen. So it is ideal to optimize BMI for the couple, for the male and female, while they're trying for pregnancy naturally. It's even been shown to affect fertility treatments, anything from your standard fertility treatments to IVF as well. But this was a study that looked at natural fertility over a year.
Okay, so what would you say to couples out there trying to conceive?
So obviously it depends on the woman's age also as a rate limiting factor, but it's very important to optimize their weight and to lose weight via diet and exercise, to really have a good meal also and have a good diet, but also calorie restrict to a certain extent and have cardiovascular exercise at least 3 times a week, 30 minutes every time.
Okay. Anything else that you'd like to add about this research?
It's basically one of those findings that I think is thought of as common sense to most people, but the big highlight of this is to look at the male and the female's BMI.
Yeah, so the male as well. I mean, it's not just the mother that needs to maybe work on the BMI, but father as well needs to focus on that.
That's correct.
All right, Dr. Kavusi, very important information for us this morning. We appreciate your time. Thanks for coming in.
Thanks for having me.
We'll be right back.